Low blood oxygen, or hypoxemia, is a common but deadly complication of many illnesses. It is easily diagnosed using a pulse oximeter, and medical oxygen is the only treatment. Oxygen is readily available in wealthy countries, but is often unavailable in lower-income countries where clinics and hospitals lack the infrastructure, tools, and skills needed to deliver oxygen to patients.
Oxygen is one of the most essential medicines for saving patients with COVID-19 and many other conditions. Many countries simply do not have enough oxygen available to assist sick patients as they struggle to breathe.
More than 46 million patients require oxygen every year, from newborns struggling to breathe in neonatal units to adults fighting COVID-19 in ICUs, or patients undergoing even simple surgeries. The need for medical oxygen also reaches beyond hospitals, in ambulances, rural health centers, and all across the healthcare system. But health facilities often don't have the equipment they need to diagnose and treat patients. Even when they do, health workers often aren't trained on best practices, and technicians can't fix broken equipment. As a result, only 20% of hypoxemic patients are diagnosed, and less than half receive oxygen.
Most of our children, the first point of care is at a dispensary level. And at the dispensary level, there is no oxygen. If there is any referral, the mother has to wait until an ambulance is sent from the central point, which is about 30 kilometers to the facility, to be able to save that child. And that child would be there without oxygen until the time the ambulance arrives.
The worst pandemic in a century has widened the oxygen gap and pushed many health systems beyond their limits. But we must take immediate action and make access to oxygen truly equitable, now and into the future. We know how to solve this problem. Our approach was built while working to increase access to oxygen for childhood pneumonia through pilot programs in India, Ethiopia, Kenya, Nigeria, and Uganda. We do 4 things to make sure we get oxygen to patients who need it. We help governments and their suppliers build partnerships that provide reliable, affordable oxygen to health facilities. We support doctors and nurses with clear clinical guidelines and training so they can quickly and confidently diagnose and treat hypoxemia. This includes the use of handheld pulse oximeters and training for technicians so they can keep equipment running. We support governments to develop financing mechanisms to fund operating costs, increase capital investment, and keep oxygen systems running without donor support. And we build data systems to measure progress and target investments to where they are needed most. Together, these 4 components can close the oxygen access gap and build a system that will sustain itself and last far beyond our support. But we need partners like you to put this plan into action. $1 million will train health workers on hypoxemia management in over 300 health facilities in 1 country. $5 million will establish partnerships with industrial gas suppliers to reduce the cost of oxygen by up to 70% in 1 country. $10 million will see oxygen plants installed in all referral hospitals for 1 country. Together, this coalition can help us reach our first milestone of $50 million to get our program off the ground in India, Ethiopia, Kenya, Nigeria, and Uganda. Now is the time to invest in a comprehensive approach that helps countries address today's crisis, prepare for tomorrow's, and build long-lasting systems to save lives for generations to come. Together, we can close the oxygen access gap for good.